The Prime Minister will set out the government's 10-year plan for the NHS, which Labour created back in 1948. It's expected to include shifting care to the community, more GPs, making it a service fully available 6 days a week. I mean, I think hopefully 7 days a week at times.
That would be ideal, wouldn't it? Yeah, but with long waiting lists, staff shortages and, of course, crumbling hospitals, will Labour's plan be enough to save the NHS? Well, we're joined by NHS Dr Emeka Okorocha, who believes Labour has what it takes to deliver, and also former Conservative Health Secretary Stephen Dorrell, who says he hasn't heard anything in the plans that he didn't suggest himself years ago. There's very little that's new in the world, particularly politics, but we'll find out first of all. Now, Dr Emeka, you're on the front line, you're right there. When you see this outline, and we're waiting for more detail later today, what are your thoughts about it?
Honestly, I'm really optimistic and I'm thankful because I think the government has now identified the changes we need now and the changes we're going to need in the long term. And I feel, obviously, no disrespect to anyone else in government, but having spoken to politicians before, I think it was very easy to set out a big 10-year plan and be like, in 10 years, this is how the NHS is going to look. But I said, but what about now? Like, what are we going to do for patients now? Because often people want to live in the moment. Yes, in 10 years, that would be great, but we have issues now we're not addressing. But I feel like now we are.
Now, you're going to be speaking to Wes Streeting, the Health Secretary, and the Prime Minister, I understand, straight after this announcement.
Yeah, correct.
So you'll be watching very closely. Are there questions that spring to mind you want to ask them?
Yeah, there are some personal questions, definitely, that I want to ask in terms of expanding on some of the stuff they've already said. I've spoken personally to the Prime Minister and Wes Streeting previously on this issue, and the way they addressed it and the empathy they came, it looks like there's actual change going to happen now.
But is the money there, Dr Emeka?
Well, they said it's been backed by 29 billion over the span, so I'm hoping so.
But the rise in money in the next 4 years is less than the rise of money we've seen on average since 1948, and the capital spending budget is totally flat, and they say they're going to build all of these new community centres. So how are they going to do that?
Honestly, I'm not sure from that perspective, but all I know that I think they're going to save money in a lot of different ways. So, you know, one of the ways that the reform is going to work is transferring a lot of the analogue systems into digital, which is going to save a lot of time and money for us as workers working in hospital and in tertiary centres, and also for patients as well. So hopefully there are going to be so many ways we save, we're going to have money to input into other areas.
So, look, Stephen, Dr Emeka is beaming. He's delighted. You say you've suggested this before. What was wrong with it before? Was it just the way you sold it?
Well, no, it's not a question of the way you sold it. It's actually the exchange that just happened between Emeka and Ed Balls. Because Ed and I share a background. We're both former Treasury Ministers. We've both looked at the numbers. And there are some hard choices to be made about how you use money as effectively as possible to deliver the objectives. The objectives of Wes Streeting, nobody can argue with them. As I've said many times, they're roughly the same. Not exactly the same, it's 30 years later, but they're roughly the same as what I said 30 years ago and as what Nye Bevin said 40-odd years before me. The NHS has Olympic-class expertise in writing plans. The difficult bit is delivering them. And that means making choices and addressing precisely the issue Ed identified, which is that the demand for services is continuing to rise. And if we look forward from today, the government's budget plans for the NHS actually are not rising as fast as NHS budgets have done historically.
When people start talking about hard choices, I get a little bit of a nervous tick because it seems to be a cover-all for not going to get the promise. That's what it feels like to a lot of people now. Conservatives talked about it. We've heard Labour talk about it. So what, looking at this, are we not going to get? Is this just a wish list, a dream? Is it that flimsy?
I think it's a bit more than that. But there's one key issue that hasn't yet been mentioned. We employ 1.5 million people in the National Health Service. That's the main focus today. We employ another 1.5 million people in social care.
Why?
What we should be doing is talking about health and social care together What the government is saying, 1 year into its period in office, is that it'll tell us its plans for social care in 3 years' time. How does that work?
But the Conservatives, and indeed in your time, social care has always been an issue.
Look, I'm not here to defend... I'm happy to, but I think probably 30 years on it's a bit late. And it's not really about defending my time, and certainly not the period of the Boris Johnson government, of whom I regard myself as a very active opponent. Now a member of the Liberal Democrats. This is about looking at what are actually shared aspirations between the professionals working in the health service. I must say, it is wonderful to be on a programme with an enthusiastic doctor that believes all of this can be done. There are plenty of times I've been on programmes with doctors who are cynical. It's wonderful to be with a positive doctor, and the objectives are shared. The question is how.
Can I ask you, on that precise issue, Dr. Emeka, you every day have got patients coming to your surgery. We've got waiting times in the National Health Service. We've got people wanting quicker appointments. Every day there's a new set. Every day then the next day, a new set. And at the same time, the government is saying, we want radical reform, digitalisation, new clinics, new way of service delivery. Do you have, as a GP, the capacity to do all of these long-term reforms and change the way you're going to work, and at the same time, actually deal with those queues of patients tomorrow and the day after?
Well, honestly, as a GP trainee working in GP and hospital, you see it from both ends. And I think, obviously, there's always going to be demand. No matter what you give the people, they're always going to want more. And it's about dealing with the immediate issues while still having the long-term issues in your mind. So, like, one of the reasons I think the NHS plan is going to work, because we're going to focus a lot on preventative health. And anyone who knows me knows I love preventative health.
Have you got the time to do that, though? You've got all these patients you've got to see today.
We will have to make the time. Like, eventually, like, if we want the NHS to sustain and last, we will make the time, and we're doing it. We're already seeing a reduction in waiting lists. We're already seeing more patients come in. We're training more doctors. We're seeing, obviously, digital medicine saving us so much more time. Like, I remember when I started medicine and working, analogue and writing and papers and notes and discharges took forever. Now, minutes. Really? And this is already time we're saving, which we could take now, spending more time on patients discharging and admitting. So we're seeing it in real time now.
See, I want to ask Stephen Doyle this. You were the chair of the House of Commons committee back in 2010 to 2014 during the big radical Andrew Lansley reforms, which caused huge turmoil, then got ditched by David Cameron and George Osborne because they concluded they didn't work. Are you a bit of a big radical reform sceptic now?
I always have been a sceptic of people who think that you reorganise the bureaucracy and all the problems are solved. When I chaired the Health Committee at that time, you may remember, we talked about it, that I was unpersuaded, totally unpersuaded, by the argument for setting up NHS England as something separate from government. But it's quite a good specific example, actually. The government, this new government came in making exactly the same pledge that Andrew Lansley made in 2010. We're not going to do a big reorganisation. He set out and did one, despite having promised not to do it. That's exactly what Wes Streeting did. He said ahead of the election, we're not going to change NHS England. He said it actually back into the November, December last year. And suddenly the Prime Minister announced in February they're going to change, they're going to abolish an organisation that employs, whatever it is, 18,000 people. Now, I was against the creation of it, so I'm no friend of NHS England. But surely if you're going to change the bureaucracy, you ought to have a plan for what you're going to put in its place before you abolish the old one.
Very
OK, well, look, we asked people at home on X if you believe the government can fix the NHS. 24% of you said yes. 76% of you said no. My goodness, they're going to have to do some convincing beyond you, aren't they?
I'm going to have to talk a lot more to convince some of these
people. You are going to.
The truth is, if the government in the next 3 years gets waiting times right down, then people will feel more optimistic. But at the moment, people just feel, fix the NHS, I can't even get my operation, I can't, I can't get my mum's appointment. That's the trouble.
Honestly, Ed, I think you're completely right. I think, especially when it comes to the public, seeing is believing. And once they start seeing the changes on the ground level, like I've seen in my work staff and my colleagues, I think then they're going to start believing. So it's just a matter of time, hopefully.
They'll get some evidence of the delivery that you're talking about then, hopefully, won't they? Well, look, good to speak to both of you this morning. We are going to be speaking to the Health Secretary